Have you ever wondered why some medicines are taken orally while others are injected or inhaled? This curiosity brings us to the fascinating world of drug administration routes and dosage forms. It's not just about swallowing a pill or getting a shot. It's about how these medications travel within our bodies to combat illness and promote healing. The chosen route and form are crucial for the drug to effectively reach its target in our body and perform its intended action. For medical students and healthcare professionals, these concepts are fundamental in understanding the science behind treatments. They guide us in selecting the most appropriate administration method for each patient, in each unique situation. So it's not just a pill, a shot, or an inhaler. It's a well-thought-out strategy, a precise science. In the next few minutes, we will delve deeper into the various routes of drug administration and the concept of dosage forms. Let's start with the most common route of drug administration, the oral route. When you think of taking medication, you're probably picturing the oral route. This is when drugs are ingested through the mouth and absorbed primarily in the stomach and intestines. It's the most common route because it's simple, convenient, and doesn't require any special tools or skills. The oral route is also versatile, accommodating various dosage forms. For instance, tablets and capsules are solid forms designed to dissolve slowly and release their contents over time. They're usually coated to make them easier to swallow, mask any unpleasant tastes, and protect the drug from stomach acids. On the other hand, syrups and suspensions provide an alternative for those who struggle with swallowing pills. These liquid forms are often flavored to make them more palatable. Then there are sublingual tablets and buccal tablets, which are placed under the tongue or in the cheek pouch, respectively. These dissolve directly into the bloodstream, bypassing the digestive system and providing a faster onset of action. However, the oral route isn't without its drawbacks. Some drugs are broken down by stomach acids before they can be absorbed, reducing their effectiveness. Others may cause stomach upset or interact with food, affecting their absorption. It's also not suitable for drugs that need immediate action, as it takes time for the drug to be absorbed and start working. Further, individuals who are unconscious, vomiting, or have difficulty swallowing may not be able to take drugs orally. And certain medications, like those for systemic infections, may need to be administered through a different route to ensure they reach their target site in the body effectively. In conclusion, the oral route offers a convenient and versatile way to administer drugs, with a variety of dosage forms to choose from. However, it's not suitable for all types of drugs or all patients, and its effectiveness can be influenced by various factors, such as the drug's characteristics, the patient's condition, and the presence of food in the stomach. The oral route is preferred for its ease of administration, but it's not suitable for all types of drugs. Next, we'll explore the parenteral route, which includes injections, infusions, and more. When we say parenteral, we're referring to any non-oral means of administration, but it's most commonly associated with injection routes. Now, there are several types of these, each with its own specific uses and advantages. First up, we have intravenous injections, or IVs, which deliver the drug directly into the bloodstream. This method is fast-acting and offers 100% bioavailability, meaning the entire dosage reaches systemic circulation. However, it also carries a higher risk of adverse effects, and once administered, the action is irreversible. Subcutaneous and intramuscular injections are two other types. Subcutaneous injections are given into the fatty tissue under the skin, while intramuscular injections are delivered into muscle tissue. These methods have a slower onset of action than IVs, but they provide a sustained release of the drug. Despite being less risky than IVs, they can still cause discomfort and possible infection at the injection site. In addition to injections, we have infusions, which are typically intravenous and allow for a constant controlled delivery of the drug. This is particularly beneficial for medications that need to be administered over a prolonged period. Now, on to dosage forms. Parenteral dosage forms include solutions for injection, emulsions, and suspensions. Solutions are the simplest and most common, consisting of a drug dissolved in a suitable liquid. Emulsions, on the other hand, contain tiny droplets of one liquid in another. while suspensions involve solid particles dispersed in a liquid medium. Each form has its own specific advantages, and the choice often depends on the properties of the drug and the desired effect. But what about the disadvantages? Well, the parenteral route is more invasive than the oral route. It requires trained personnel for administration and can cause pain and anxiety in some patients. Despite these challenges, the parenteral route is crucial for delivering drugs that cannot be administered orally, such as certain biopharmaceuticals and vaccines. While the parenteral route is more invasive, it is crucial for delivering drugs that cannot be administered orally. Beyond oral and parenteral, there are several other routes of drug administration to consider. Let's explore these alternatives, their advantages, disadvantages, and suitable dosage forms. First up, inhalation. This route allows for quick absorption into the bloodstream through the lungs. It's ideal for respiratory conditions like asthma. However, it requires patient cooperation and can be less effective if not done correctly. Next, we have topical administration. This involves applying medication directly onto the skin or mucous membranes. It's great for treating localized conditions like eczema or a burn. On the downside, absorption can be unpredictable and it may cause local irritation. Then there's the rectal route, which is useful when oral administration is not possible or desirable, like in cases of nausea or vomiting. It also bypasses the first-pass metabolism in the liver. However, it can be uncomfortable for the patient, and absorption can be irregular. Vaginal administration is another option, primarily used for local treatment of conditions like yeast infections. It provides high local concentration of the drug, but can be messy and inconvenient for the patient. We also have the nasal route, which is often used for local effects, such as treating nasal congestion, or systemic effects, like delivering a migraine medication. However, it may cause local irritation or discomfort. Lastly, there's ocular administration, where medication is applied directly to the eyes. It's perfect for treating eye conditions, such as glaucoma or conjunctivitis. But it can be challenging to administer, and the drug might be rapidly drained away, reducing its effectiveness. These alternative routes of administration provide flexibility in drug delivery, addressing specific patient needs and drug characteristics. Each route has its own unique advantages and challenges, and understanding these can greatly improve patient care. So whether it's a quick puff from an inhaler, a soothing cream, or an eye drop, remember that the route of administration is just as critical as the drug itself. Now that we've covered the routes of administration, let's discuss the concept of dosage forms and unit operations. Dosage forms are the physical forms in which drugs are administered. These can range from tablets and capsules to gels and injections. The dosage form is crucial as it determines the route of administration and the rate at which the drug is released into the body. Each form has its specific advantages and limitations. For example, tablets are easy to administer and carry around, while injections can deliver drugs directly to the bloodstream for immediate effect. Now let's delve into the unit operations. Unit operations are the fundamental activities involved in the preparation of these dosage forms. They're like the building blocks of pharmaceutical manufacturing. Let's take a look at a few examples. First up, we have granulation. This process involves the formation of small particles or granules from a powder. Granulation improves the flow of the powder, making it easier to compress into tablets. Next, we have compression. This is where the granulated powder is compressed to form a solid dosage form, like a tablet. Compression ensures the drug is packed into a small, easy-to-swallow form. Finally, there's coating. This process involves covering the tablet with a thin layer of coating material. Coating not only improves the appearance of the tablet, but also protects it from moisture and masks any unpleasant taste. There are many more unit operations involved in the preparation of dosage forms, each playing a significant role in ensuring the final product is safe, effective, and user-friendly. So the next time you pop a pill or apply a gel, remember the intricate processes that went into its creation. Understanding dosage forms and unit operations is fundamental in ensuring the safety and efficacy of drug administration. In this video, we've explored the various routes of drug administration and the concept of dosage forms. We've delved into the complexities of oral and parenteral routes, each with its own unique advantages and challenges. We've also touched on other methods of administration, showcasing the diversity and adaptability of modern medicine. We've unraveled the science behind dosage forms, illuminating how these crucial components determine the efficacy of a drug. We've also journeyed through the meticulous unit operations involved in preparing these dosage forms, underlining the necessity for precision and expertise in pharmaceutical practices. Understanding these concepts is pivotal for effective and safe drug administration. It's not just about swallowing a pill or getting an injection. It's a comprehensive process that requires knowledge, precision, and a deep sense of responsibility. Thank you for joining us on this journey of understanding. Stay curious, keep learning, and don't forget to subscribe for more.